Normal for periods can vary quite a lot, but they shouldn't interfere with your everyday life. You should be able to go to school, play sport, do all the usual things that you would do without pain or the heaviness of the bleeding interfering with that. Pain is definitely not normal beyond what a simple Panadol would take care of. So in that circumstance, I would highly suggest that you keep a diary of your cycle for a couple of months. Keep a really descriptive account of what symptoms you're getting. Not just, I've got bad pain, but I've got pain that made me curl up in a ball and I couldn't move. And then take that to your doctor. So endometriosis is a disease that affects reproductive age women. So from the time of your first period until the time of your last period, you can suffer with it. It's a disease where cells, the same as the lining of the uterus cells, implant in parts of the body that are not the uterus, where they shouldn't be. And they cause symptoms because they are active within those different parts of the body. Periods can be extremely painful, and you can also get pain in the pelvis at other times of your cycle, maybe with ovulation. You can get pain with intercourse. Sometimes if the bladder or bowel are affected, you can get pain when you go to the toilet. So treatments for endometriosis usually will start with simple treatments with hormonal manipulation. A common way of doing this is with the oral contraceptive pill, and then you will gradually work through different options as necessary. Can get to the point of needing surgery. An operative procedure called a laparoscopy, where we put a telescope into the tummy through the belly button to have a look at what's going on. That is the diagnostic test of choice for endometriosis because it can be really hard to detect otherwise. If you do have endometriosis, then you can go on and have more in-depth surgery where we try to excise or vaporize the deposits of endometriosis that are in the abdomen. Women are very stoic and they tend to put up with a lot. They tend to be busy, they've just got to get on with life. Have your diary and go and see your doctor.
Care to Share, brought to you by Buderim Private Hospital, because your health matters.